talking with you about graft-versus-host disease. This is common and sometimes a serious side effect of the allogeneic stem cell transplant or cord blood transplant. The allogeneic transplant uses someone else's cells. So a definition of graft-versus-host disease is when the donor cells recognize your body as being harmed. There are other terms that you'll be hearing or may have heard that they use to describe graft-versus-host disease. It can be graft versus tumor, graft versus leukemia, so graft versus disease. So there are two types of GVHD, and one is called acute and one is called chronic. The acute usually occurs in the first 100 days after transplant. Usually affects the skin, the liver, and the intestines. That is why we are always looking and asking you if you have any rashes. We are monitoring your liver enzymes. And if you start developing diarrhea, we will be running tests on that to determine whether it is something infectious or whether this is GVHD. One thing I need for you to know is that you do not have to be Sherlock Holmes, so to speak, and figure out whether this is GVH or whether this is something else. That is for our professional team to do, but what we need for you to do is to be very cognizant of reporting your symptoms to us. So we will begin with talking about skin and also how we can prevent that. You're going to be on an immunosuppressant medication. It could be tacrolimus, it could be cyclosporin, or it could be sirolimus, but all of those make you very vulnerable to the rays of the sun. So when you are out in the sun, you need to make sure that you are wearing a sunscreen, that you wear sunglasses, and if you need to wear a hat on your head. Because if you get a burn, that can set you up for GVH of the skin. GVH of the skin in the acute phase manifests itself by being a very faint to severe sunburn. It can have rashes, it can have blisters. If you have nausea that doesn't go away, that could be GVH of the stomach. Loss of appetite, vomiting or throwing up that we cannot take care of with our anti-nausea medications. Feeling full after eating. If you swallow your pills and you feel like they're getting stuck in your esophagus, that could be a sign of GVH of the esophagus. With the liver, we will notice your liver enzymes going up. Your skin can become yellow. You can notice your urine becoming dark colored, or you could be having pain in the upper part of your abdomen. So those are things that you need to call us about, tell us about immediately, because we have medications and treatments that we can do to treat GVH. As you are probably already hearing, GVH can affect any organ of your body, any part of your body. Chronic GVH, that happens after 100 days after transplant, and it can sometimes be 3 to 6 months after your transplant has happened, or even up to a year. So if you notice that you're developing a rash on your skin, that your skin is getting thickened, you've got unusual hair loss or thinning, if your skin is becoming itchy, you notice nail changes, we need to know about that. For your joints and muscles, if you are starting to feel this arthritic-like pain, muscle pain, cramps, and weakness, GVH can affect your eyes. If you have dry eyes, if they feel very irritable, if they feel very itchy, if you have blurred vision, if they're teary, we have a special ophthalmologist we'll send you to, and they will be able to help you with that. GVH in the mouth. Mouth can be very dry. You can have difficulty in opening your mouth. You can have sores. You can have irritation that doesn't go away. If you have these chronically chapped lips, or if you have pain in your mouth. GVH in the lungs is a cough that doesn't go away, shortness of breath, you're having trouble in breathing. As I said before, of the digestive system, if you have chronic nausea and vomiting, you can have this diarrhea that's very profusive, stomach pain and cramping, and it can even affect your genitals. For women, they may notice painful intercourse, they've got this rash, they have a lot of irritation and dryness. And many early warning signs of GVH could also be caused by an infection or another side effect of one of the medications that we may be giving you. So it's very important that you communicate to your doctor any signs and symptoms that you may be having. I tell patients all the time that keep a journal, and when you come to clinic, bring that with you. So if you're having any signs and symptoms of anything that is different or something that you wish to discuss with your doctor, that you are able to discuss that with them, and you don't forget about that in the course of coming to clinic, getting your blood drawn, getting your repletions, and so forth. So that is the end of the graft-versus-host disease. And if you have any questions, please refer them to your physician, or you can talk with one of our healthcare providers on the unit when you come in. Thank you.